Mindy Irvine with Oasis Physical Therapy. Today I had surgery on my wrist. I had an axial block that left me numb from the elbow down. I have no control from the elbow down. When you find yourself in this position, you have to take good care of your arm to keep the swelling under control and to keep the pain under control. So what I'll be talking about today is some ways to care for your arm in the early stages of post-op recovery. After surgery, it is important to keep your arm elevated and apply ice. This helps to keep your swelling down and speeds up the healing process. Another way to reduce swelling is to increase circulation by opening and closing your hands like this. Alright, as you can see, I am now in my next stage of rehab. The bandage has been removed and you can see there's still stitches in place and I have a clear bandage on. But now I'm able to do some very simple exercise. Now remember, I didn't have any tendons repaired or any ligaments repaired. All I had was hardware taken out. Same exercises would apply to carpal tunnel or getting hardware put in. You want to go by your tolerance as far as how much activity that you do. So I'm going to show you a couple of simple exercises that are now safe to begin. And remember, if you're doing these at home, you want to make sure that you have your doctor's permission to begin these exercises. First one is just active range of motion. So there's different planes of motion that your wrist moves in. First of all, you can go down as far as you can and up as far as you can. So you can go through that 10 to 20 times to your tolerance. Next position is with your hand straight up and down, your thumb up like this. You're going to raise your thumb up and your pinky down. Pull your thumb up and push your pinky down. And you can do that 10 to 20 times. That's called radial and ulnar deviation. Next, we're going to do pronation and supination. So that's turning your palm down to turning your palm up. As you can see, that's the one that I'm restricted in. It doesn't want to go all the way up. Sometimes it's easier to do your exercises with both hands because then you feel how it is supposed to be with your good hand. And then you know what you've got to work on in your other hand. Okay, so you do that again to your tolerance. If you feel any pain of any kind, then stop and ask your doctor if you have any concerns at all. Okay, so that's the active range of motion in all directions. Okay, the next exercise you can do is called Isometrics. And this is where you're applying some force with your good hand and you're not going to let your hand move at all on the involved hand. So I'm pushing from this side, hold it for about 5 seconds. And then I'm going to push from the other side and hold it for about 5 seconds. And this doesn't hurt at all. And what it does is it starts to get the blood flowing, which helps with the healing. And it also starts to very gently strengthen the muscles around the involved joint. And you can also do the other motions. All the motions we just did actively, you can push in those directions as well. So we're going to push down and then push up. Push down and push up. And then one more direction would be resisting pronation and supination. So you can turn your hand palm down and try to turn it up. And then turn it palm up and try and turn it down. Go back to this way. And back, palm up. And repeat that 10 to 20 times. You may want to start with 10 and then see how your body reacts to it. See if your hand hurts at all. You want to make sure that you're doing this with no pain. Another range of motion exercise that you want to do in the early phase is try and touch the tips of your fingers to your palm like this. Pretend like there's dots right here and you're wanting to touch your finger to the dots, keeping your fingers extended as much as possible. You don't want them to come forward. Keep it straight. Touch the tip of your finger here like there are dots there that you're trying to touch. And you can do that 5 to 10 times. or up to 20 depending on your tolerance. The next progression is touch your fingers here and then keep your fingers straight as you bend down. Touch like this, like you're making a claw, and then try and keep your fingers straight as you're making like a table. Claw, table. That helps your tendons glide and helps you maintain full range of motion. Okay, so far we've been doing active range of motion to help you get full range of motion actively, but now we need to do passive range of motion. So what you want to do is take your other hand and pull it down gently into flexion until you have a pain level or discomfort level of about a 3. It's important not to push it much further than that. You don't want to increase your pain level, so keep it within tolerance and hold it there for about a minute. So with this, you can either set a timer or watch a clock and hold it for a minute going down. When that is done, you can release and do that again up to 2 or 3 times in a row, and that's passive range of motion for flexion. Next, you'll go the other direction, and there's several different ways to do this. You can pull your hand up and hold that until your pain level is about a 3. You can also push it against the wall or push it against the table to hold your hand up in this position to try to increase your extension to within your normal limits. Again, hold for a minute, repeat it 2 or 3 times, and that's to improve your extension. So we've got flexion we did first, and then extension. And then the last one that's most important with a wrist surgery is supination. So like we showed earlier, I don't have full supination. So you take your other hand and push it. So you can see that that's almost flat because I'm helping it with the other hand. And my pain level is pretty low. It's about a 2 or a 3. So I'm going to hold it there for 1 minute. And then when the minute is up, I'm going to let that relax and then do it again. So you're going to repeat 2 to 3 times. It's important to keep your pain level really low with this. You want to feel a stretch for the full minute, but you don't want it to hurt more than a 3 on the pain scale of 0 to 10. A couple more things to remember is, in my case, I'm about 6 days post-surgery. So you still want to be applying ice 2 to 3 times a day or more often if you feel you need it, and holding that ice pack on your area for 10 minutes, 10 to 15 minutes. Another thing is you want to make sure that you keep it elevated as much of the day as you can. In the case of a hand, it's really easy to hang it down at your side, or if you're typing on a computer, your hand is down. That's going to cause more swelling. So the most important thing during this phase is to get your swelling and pain under control. So ways to do that is to keep it elevated, especially at night. You can put it up on a pillow and put it above your heart. You can also apply ice, and you can take ibuprofen if that's approved by your physician. While you still have stitches in your scar, there's a couple things to be watching out for to make sure that you don't get an infection. Make sure that you report anything to your physician that looks unusual. If you have any pussy discharge from the scar, if you have a fever, if you have a temperature of over 100, make sure and let your doctor know. If it feels hot to the touch, if it feels extremely sensitive to the touch, those things you all want to let your doctor know right away. The scar is healing. The skin can get really dry over the scar, and that can make the healing slower. So one of the first early things you can do, as soon as your scar is closed and your stitches are removed and your doctor gives you the okay to put this on, what you do is you take a vitamin E capsule and a pin and poke the end of it, and then you're going to take the capsule and squeeze it and take the vitamin E and put it onto the scar, and then using a couple fingers just massage the oil into the scar tissue. And then you can put on, there's a compression sleeve that you can get for your wrist, and you can put the compression sleeve over top of this, and in just a short time you will see this vitamin E oil will be fully dissolved into your skin. This is something that we haven't talked about yet. This is an ointment called Topricin that is an anti-inflammatory cream that you can get at a health food store. It is very helpful to put on the scar to decrease bruising and inflammation. This is an essential oil called lavender, which is good for inflammation and pain. This is the Scar Away silicone sheets that we talked about earlier. It is very helpful to shrink, flatten, and fade old scars, and you can get it at any Walgreens or local pharmacy. This is the vitamin E capsules that you can get at your local pharmacy. Just make sure that they are the gel caps. All right, thank you so much for joining me today. I hope you were able to get a lot of valuable information and learn some things that can help you heal and get back to what you enjoy doing the most. If this was valuable to you, please give me a thumbs up and leave a comment down below. Always interested in how we can improve these and make them even more valuable to you. Thank you so much and have a great day.